Kuan Yin has been a lovely patient of ours since July 2023, and she's come in with different layers of low back pain, hip pain, and her thigh pain. And recently her low back pain and her inner thigh pain has been really getting loud in volume. She hasn't been coming in as much, but she's also been really pushing her workouts, doing more squats, doing more walking. We already know that she has a labrum tear and also hip arthritis in the cartilage. She also has some disc degeneration in her low back. Part of what needs to be done when somebody has different locations of symptoms with different provocative movements is really tying together those locations and provocatives. When she sits, her low back pain is really bad, and then when she lies on her back, she really feels her inner thigh pain. And when I brought her thigh to her chest, her inner thigh pain went through the roof. And then when I treated the hip structures in this visit, in the femoral nerve at the anterior iliohypogastric nerve in the front of the belly and the hip capsule in the back, that inner thigh pain really went down. I hope you enjoy this visit. See you later.
Did you have low back symptoms this weekend?
I actually did.
How bad was the low back that night? A Saturday night is 0 to 10.
Not bad, like a 5.
Was it the right side? Or?
Yeah, just the right side. It's that usual thing that I'm used to, so very chronic.
Well, I feel like we're treating it kind of like as in the beginning, kind of like with the new thing, and
Well, we can do that, I believe. Like it definitely hurts behind my leg.
pain or tightness.
It's tight, but there's a line of pain, my regular line of pain, like from here to the side, down my leg, to my big toe and second toe.
How intense from 0 to 10?
Like a 5 or 6.
Increase?
Yeah, but only like maybe 0.5.
What does this do?
Nothing. Maybe it feels a little better.
Cool.
This usually it burns here and it's sore everywhere else, but this time it's burning here. And I don't know if it's because of the work you did.
When I lifted your leg up, you felt burning here.
Well, now I'm still feeling it when I put my leg straight up.
But when I had it up, you didn't feel it.
Well, yeah, I did feel it. It's just like along the line, but here it was burning as opposed to sharper pain.
And the toes over here on the bottom, right?
Yeah. And then as you bring my leg down, actually right here, then my groin hurts a bit. Like it's not really the groin, it's like this tendon here maybe. This one. Like here.
Up just like that for me? On the way down, you felt that pull.
Yeah. Yeah, that hurts. Ah, yeah.
Where?
Right in that. Where
How intense?
like a 9.
Oof.
When it's just down, it's kind of achy, but
And when you lay down on your back, you feel the achiness in the hip.
you know, it's right in this though. I don't know if that's the hip or if something else.
No, you're right. But when you lay on your back, you feel the achiness increase in the hip.
Yeah.
So you said your right low back is bothering you,
It was
The
bothering
most.
me a bit this weekend.
but your hip had 9 out of 10 pain. Face this way on your side, please. She has right low back symptoms and the front of her hip hurt a lot when Casey brought her right knee to her chest. So I'm trying to hit 2 birds with 1 stone with her hip flexors here. This could make her low back better and the front of her hip symptoms better. We'll see how this treatment goes. So I was just feeling for where her worst spot is Right now, I'm between the anterior iliohypogastric nerve, which runs like this, and the femoral nerve, which runs like this. And I'm in that intersection. And just moving around to see where the adhesion is and where the spider web kind of sucks me in. And that's where I want to treat it.
When you say the spider web, what's the spider web?
I'm realizing more and more that the adhesion, the spider web is the adhesion. The adhesion's a spider web. When you stick your finger in here, it'll feel like
Little strings.
it feels like little strings that you can feel which way you want to. After 15 years of doing this, I feel which way it wants to pull me tight. Go ahead, Casey. And then I just fight that tension because I want to feel a lot of tension very quickly in the movement in order for it to be a high priority adhesion. Good. And then if I'm on a good spot, it'll soften as soon as I'm done with it, which means that the treatment was effective.
Full. What do you feel here?
Pain in my groin.
Point to me. The right proximal groin area. Pain. How intense is the pain?
7.
7. You still have this pain over here?
No.
Where was that groin? Right in here?
Oh, in here.
Capsule. I'm thinking that's a hip impingement. So we're gonna see if releasing the hip capsule causes the ball and socket joint here. So if it's pinching on the front side over there, then it's usually the stuff here that's pulling tight and it causes the bone to move forward. We'll see if I'm right or not.
Full. What do you feel you're going?
Still feel a little bit in the groin, but it's like more of a 3.
Tightness or pulling or pain?
Ache.
3 out of 10, 8. The right proximal groin.
Usually the two tissues that limit hip flexion, the thigh to ribs the most, are the posterior hip capsule and adductor magnus. And so I'm checking adductor magnus. Right now I'm focusing entirely on unloading her hip joint and her labrum tear. We didn't have a provocative movement for her low back, but I want to make sure that the hip is unloaded and then any of the hip flexor stuff that's overactive will calm down because it doesn't have to protect the hip joint. I know with me, when my hip joint's inflamed for a while and I have symptoms, my low back usually follows soon after that because my hip flexors get overactive to try to stabilize my hip joint.
Full. What do you feel?
Nothing.
Yes.
This was really bad, so had you been squatting a lot in the past few days?
Yes. She's been doing a lot of jumping this Saturday.
I don't know how that's serving you. This got really irritated very fast. It doesn't mean you might not be able to do it, I just think you just need to be slower about it.
Slower. Okay.
We need to find how much you want to stress your tissue a little bit, but not have it be like that, because, and God forbid you weren't getting this treatment, it would go downhill very fast. But if you go slower with it and you find that line where the tissue can mostly recover from the workouts you're doing, maybe at some point maybe I'll teach you how to feel. I should have done that today, and I've never done this before, but maybe I teach you how to feel the tissue down here, because if you can feel like when it's soft or when it's super hard and irritated, then you'll be able to just check in with yourself. Thank you for that. I never thought how to do this. So maybe I'm gonna start teaching people how to just check in with their tissue when you have a spot, because right above your ligament here is that spot on you that just gets very janky. If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe, stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.